Good afternoon. Pleasure to have you with us. I'm Brian Boehme, physiotherapist at Elite Sports Medicine, and I have the pleasure of being joined by my favorite 17-year-old in the world. It's my daughter, Madison. So excited to have her here. You have anything you want to say?
No.
Okay, good. All right. Let's get right into it then. We are going to show you some simple examples of ankle mobility exercises. And you could be thinking of it as an acute stage, so just after an ankle sprain, all the way up to, say, maybe a little more aggressive as they're getting over the acute stage, maybe even a chronic ankle issue that's been stiff and tight for some time. My daughter's a perfect example because her ankles have been an issue over her professional career.
Yeah.
So we're going to get right into it. All right. So Madison, let's assume that you have an acute ankle injury. Just sprained your ankle, say a couple days ago. It's still swollen, still tender. So I'm going to have her do some simple ankle pumps, ABCs, really basic, easy exercise to do that anybody could do just about anywhere you want to go and throughout the day. So back that way. Just like this. So with her foot just kind of off the edge, this is what I mean. She could be on a couch, she could be on her bed, totally fine. But the idea with this one is just making sure that she understands it should be fairly pain-free. A little bit of soreness is expected, but she should be able to do a simple ankle pump up and down and feel pretty comfortable. You can see how swollen her ankle is with the acute injury that she's had. Or, as I said, she could do the ABCs, which is a little more complicated. You're going to do a little bit of a pumping action, but also get some inversion, eversion in there, a little circumduction as you do that. So it just depends on how acutely sore she is. But as best she can, she's going to go through those motions. As far as how much to do, depends on how sore she is. She might do only 10 ankle pumps, and that be like, okay, I'm done. It's a little sore now, so then I just call it quits. If you can get through the whole ABCs, awesome. Either way, kind of let pain be your guide on the acute stage. Okay, next one. Let's say she's getting a little bit better. She can put a little more weight on the ankle as she's healing. So I'm going to have her stand up on this little bench here, facing that direction, and she's going to do a little stretch. Different names for it, but basically all I'm going to have her do is have her foot close to the wall, and then basically have her knee get as close to that wall as she can without letting her heel come off the floor. Just a knee to the wall. One of the common things you'll see patients cheat with on this one is as they glide forward with their knee, you'll see their knee maybe wanting to buckle in a little bit, which means their arch of the foot is also buckling in. I don't want to see that. When she's doing it, just try to make sure that the knee tracks right over the foot. And can you feel that stretch a little bit on that one, Madison?
Mm-hmm. Yep.
Mostly she's stretching here. When it's sore in the acute stage of the ankle injury, she might feel some tenderness in some of these spots in here. That's once again to be expected. Make sure that it's still comfortable, even though it's a little sore, is what I'd suggest. She's going to do that about, once again, 10 times or so. It's a good little stretch. The last one that she's going to do is the most aggressive, and generally is one that you would do with an ankle that's on the chronic stage, maybe has been stiff and tight for some time, or she's just getting back into sports and maybe feels that after the acute injury she's a little stiff and a little tight. So this is a really good one that she could do even courtside would be fine. So she's going to turn her face towards the camera, okay? And on this one here, at this point, she's going to get, say, well, I'll bring this one down too. And the reason why I do this is because I want you to be able to see right in here is this inside aspect of the ankle joint. Right in front of it is called the talus bone. That's the bone I want to be able to make sure glides really well into the joint. So to help with that, she's going to take this heel and put it right in front of this bony prominence, right in front of this bone, but of course it's on her right foot now. And that as she does this little exercise, I'll be a little picky. I'm going to make sure that this heel puts some pressure on that talus bone so that when she does the little mini squat, it's going to help glide and force that ankle to dorsiflex, force that talus bone into the joint. When she does it, I'll hound her on making sure that when she does it, her knee glides over her foot. Just like that, that's better. Weight stays a little bit more on the heel as she's doing it, because then it makes sure she's getting that better squat, not allowing the knee to track too far over her foot. And she'll do that maybe about 5 to 10 times as well. This one's meant to be more aggressive, so it's common that's a little bit sore, but make sure it's tolerable. Awesome. That's about it for today. Thank you, Madison, for being my guinea pig here.
No problem.
Have a great day. Ram Pride.